for having us back, and thank you all for coming back if you attended when we were here with Anthropic talking about our MCP. I'm Ann Zink. I am a practicing emergency medicine physician, and I was the state health official in Alaska. And so, really excited to see that you're doing the tribal layer, and would love to kind of learn more in that space and see many familiar names and faces here. Part of after I stepped down from the state was really interested in how we can make data more accessible to others, and part of the reason why I came and launched this project with Dan Weinberger at Yale about 18 months ago. So we did throw together the last time we came and talked. We were here with Anthropic. It was very fast. We kind of talked a little bit about PopHIVE was, went right into our MCP. And so we thought we would come back and share a little bit more about like PopHIVE structure and data, and then how we kind of set up the MCP and what can be used on top of it to provide a little bit deeper dive, but really look forward to kind of your questions. But before I get started, I thought maybe just our team could introduce themselves so you kind of know who's here and we'll be answering questions. But Dan, maybe I'll turn over to you to introduce yourself.
Yeah, hi, I'm Dan Weinberger. I'm a professor of epidemiology at Yale School of Public Health and an infectious disease epidemiologist and do statistical and mathematical modeling, and I lead the data team here at PopHIVE.
Awesome. And Callie.
Hi, I'm Callie. I'm a program administrator for PopHIVE, so I'm part of the data team. I'm just trying to get the data more accessible.
Awesome. Maddie.
Hi, my name is Maddie. Once again, I'm a new team member. Did my MPH in epidemiology at Yale, and I'm excited to see how AI will help us actually put the public health data to use in a quicker and more uh, organized fashion.
Awesome. Thanks. That way, if you send our team an email, you've got questions, people have different kind of focuses. We sometimes joke that it's been the Dan and Ann show for 18 months, and we're so excited to have these different team members on board with us and helping to move things really quickly. And so wanted to share that. So I'm just going to share a quick few slides about, again, like grounding what PipeHive is, where our data is at, and then a little bit about our MCP. And then Dan is going to show a demo of kind of our slide a little bit more, and plus or minus a demo of the MCPs, because it looks like all of Anthropic's MCPs have just recently gone down, including Strava and Google and the rest of it. So, this is life and why you have a redundant system. And so we'll see by the time I finish these slides where we're at with if Anthropic has figured that out or not. So I'm going to start with just kind of some basic slides, and we're going to go to slideshow. Can you guys see that okay? Okay, awesome. And you guys are welcome to these or not, and I'll go through them quickly because more than anything, we want this to be an ongoing question. You all know most of this space and how fragmented and delayed like it is to get health data. I was always so, I guess, saddened, I guess I would see, seeing my epidemiologist spend all this time just trying to collect data instead of you being able to use their brilliant minds to do epidemiology. And I'm like, how can we make it easier for you to have the data you need so that you can spend the really important work trying to get the data out and accessible to people? There's so many reasons for this, and we could spend multiple meetings talking about it, but we're just trying to figure out what ways we can move towards solutions. So really, our mission is to democratize health data, to make it publicly accessible and user-friendly, to link, integrate, and simultaneously visualize de-identified data. So nothing that we're doing is at the identified space. This is never going to help you with the TB outbreak. This is not going to help you with trying to figure out the cyclosporiasis, patient contacts. But what this can do, and we can even share our cyclosporiasis website, is like understand like what's happening between your location, other locations, and be able to ingest data from a series of different sites to better empower you. I think there's kind of three themes that we were kind of core to our mission. How can we collect once and use often? I think the second one I really wanted to emphasize for this group is that I guess I got really frustrated with this in Alaska when people would interpret Alaska data for me that was really not useful. So we really think that data should be interpreted locally and used locally. So this is where you all, as state health officials, local health officials, others, make such a role in this. And our goal is just to get the data there for you so that you can do the interpretation, you can augment it with other data sets and sources that you have and put it into context to really have data for action. And then just this real belief that de-identified population health data should be publicly available to enable the private sector, individuals, communities, healthcare, others to be able to engage and be partners with public health and population health to improve health overall. We have to add pictures of more of our new team members, but then there's
And we can't see your slides.
you can't see my slides?
Nope.
We see, yeah, it was not showing a slideshow. It was just on the first one.
I was so excited. And okay, let me try again. Let's see here. Nope, that doesn't. Let me like exit full screen. Okay, can you see that?
Yeah, it's not projecting in slideshow, but it's advancing.
How's that for slideshow? Can you see that in slideshow now? Nope. Yes. No. Okay.
No, just the slideshow.
Okay. We will just make this a little bit bigger and we'll just go from the slideshow. It's actually not, what's really cool is Dan stuff that he's going to share. So, we'll just go through this stuff just really quickly. So there's a group of people. I sometimes joke that working at Yale kind of feels like working with Mary Poppins. Like I'll be like, hey, Dan, do we have a person who can help with this? And then there's someone who knows the space really well at Yale. So that's part of the reason we've kept it based at Yale. We have a ton of partners, so everyone from Epic and are able to see the Epic Cosmos data, Carnegie Mellon, who does a lot of claims data, home thermometer testing data, like the Kinza data, crisis text line information, so trying to have insights on what people are texting about. As we talked about before, Anthropic. So just highlighting there's a series of different data sets and sources that we come from. And the idea is to create kind of live dashboards, braided data sources, able to provide near real-time signals, as well as granularity and whole person care. Because at the end of the day, each of these data sets kind of approximates the truth, but by being able to integrate them. But one of the challenges in integrating them and having them all there, it's a lot of information all at once, and why we kind of built the MCP to be able to improve the access to the information that's there. I guess just from public health, I threw this slide in here. I think there's been this concept of like local sharing to sharing to state and state sharing to the feds. That's kind of analyzed and information's kind of pushed back down. But as you all know, there's a lot of information that is now publicly available or within the healthcare sector and other components of the health tech ecosystem. And so, what ways can we also push that information back to states and local health departments so they can adjust it, add additional data sets and sources? So thinking about how do we kind of move from this traditional model to really taking off that burden of local and state health authorities to have a lot of that additional data in their hands and be able to augment it with local data so that knowledge is really a two-way street and being able to inform up to larger health systems and the federal government on what you're seeing, but then also vice versa, and being able to share information both directions. There's a bunch of ways that our data is being used right now. NIH uses our data for modeling because they can't see testing data. Researchers looking at policy impacts. It's oftentimes hypothesis generating. We really try to stay out of like, this is what you should do based on the data. So we're not telling people to wear a mask or to wash food or to other things, but just trying to put the data out there so it can be used. Kind of skipping down, there's been a lot of interoperability components, and we could talk more about TEFCA and CMS and the ways that things are moving forward. But right now, because of AI and technology, we've been able to braid a lot of these data sets together. So we always are looking for ways that you can help to point us in the direction of new data that could be better used, using our data either via API, our website, or MCP server to be able to augment your data and the data sets that you're doing. And so with that, I'm just going to skip over that last slide and hand it over to Dan to kind of pull up our website, show you what we have, and talk a little bit about our Claude connector. So over to you, Dan.
Yeah, thanks very much. Can you all see my screen?
Yep.
Okay, great. So now if you go to our website, we have at the top, there's a Claude section. We'll be adding in additional AI tools over the next year or so. We've got some plans to do some stuff with Google as well. But currently we have this Claude stuff. And if all the MCP servers were working, then you could sort of go halfway down the page. And if you just click this Add to Claude button, it will take you to the Claude connector directory. And then you could add this to your Claude session. As I mentioned, or as Anne mentioned, all the Claude stuff seems to be down right now, but fortunately I do have a local version of the MCP server, so I can still demo this a little bit and show you what we have. I just as a quick caution, if you're searching the directory, there are two PopHIVE MCP servers. There's ours, which is the official one, and then there's one that somebody made about a year ago, which is very, like, it's not pulling from the latest data and stuff. So just make sure that you're pulling from the one that was developed by Yale School of Public Health. We're trying to work on getting the other one taken down to avoid confusion. But in any case, look for the Yale School of Public Health one. Okay, so if you're a Claude user, you could just go to your sort of Claude session, open up a new chat. Um, you just have to make sure that the MCP server is connected. So if you go, just click the little plus button here, go to connectors. And here, this isn't the official PopHIVE connector. It's just the one on my computer, but it would look very similar with the official PopHIVE connector there. You just make sure that it's switched on. And then, you can start asking it some questions. We found just from experimentation that you have to kind of tell it that you want to use the PopHIVE data. Otherwise, the AI just kind of goes out and finds random stuff on the internet. So, we could start a query like using PopHIVE data. What are the latest trends in COVID in the Southwest? And it should start to pull some of the tools that we developed. So basically, the MCP server just provides some structure um, for the model to sort of find the sort of best data for this, and also to put some restrictions around how it describes the data. So it's using the get map function on the MCP server. It's identified these 4 states as being in the Southwest, I guess. We could have been more specific in finding that, Texas has the highest rates, but then it's also going to give us some descriptions here as well, and should just take a second. So this is sort of the latest trends in each of the states, gives us a nice visual. And then, it gives us this sort of narrative summary as well. So the levels are low, but maybe increasing a bit in Texas over the latest week that we have available. This is just pulling from, or the plots are just pulling from one data set. With PopHIVE, we have a lot of different data sets, so it is telling us what's going on in some of the other signals as well. We could explicitly ask it to, uh, to compare the different signals of PopHIVE for Texas, and maybe it'll sort of pull those up on the same plot for us. There are a lot of different ways to use this. I find it most useful for a couple of things. One is sort of exploring what type of data we have. So I was actually playing with it this morning. We have a new cyclosporiasis resources website that we just put up. And I was at the county level, and I was sort of using this as a way to sort of pull together some of the county level data that we have and see just sort of in an exploratory way how some of the other county level indicators that we have line up with the patterns that we see for cyclo. Yeah, so you can see now it's pulling together a couple of different data sets that we have for Texas. Some of them are quite low. And again, some interpretation here around what this is doing. Also, this is very much a work in progress. So, if you go to our website, we have some key disease areas. So we have some infectious disease data, around RSV and flu and pneumococcus and measles. We have chronic disease data. We have injury and overdose data for a number of different outcomes. And the way the MCP server is set up currently, it's really focused on those data sets that are on our dashboards. If you look on our GitHub page, we have a lot of data sets. So you can just go to our GitHub ingest page, which is where we have all of our data. And if you look at our data dictionary, which I can put in the chat, this is all the data that we have, including stuff that's not in our dashboards. And currently, it's not set up to index the data, some of these other data sets. This is something we're working on now. I'm trying to get that up and running. So we have like a ton of county health data that's not yet available on the MCP server, but we really want to make it available. Super rich data set. Number of other data sets that are not yet reflected on the server itself. I can sort of go through more demos of the data. I'm also happy to talk about the architecture for the MCP itself. I know we had some questions on that last time, and sort of what that looks like. We've got, uh, some documentation here on sort of how the MCP is actually structured and sort of what some of the sort of constraints are that it look like. Also happy to talk about sort of how we train this, and sort of what that process looked like that we went through with Anthropic. So um, the other sort of point is, what I just sort of was showing you was in the sort of chatbot interface for Claude. If you're a Claude Code user, you can also sort of add the connector in and enable it in your Claude Code session, which is really powerful because if you have other data sets, like from wherever you're working, and you want to just sort of bring in the Claude data, or sorry, the PopHIVE data and compare it, you can do that. And um, and sort of access that. Oh, Ann tells me the MCP is back up and running. So actually, let me just see really quick if I can demo this in Claude Code, if it's working. We'll give it a try. So yeah, so I have Claude Code loaded in VS Code here. This is just an empty project here. And similar to what you do with the chatbot, you have to just make sure that the connector itself is enabled. So if you just go to MCP servers, oh, looks like they're actually not. Yeah, it still looks like it's down on this end at least. But you would just need to ensure that it's enabled, and then you can start asking questions here, or asking it to generate code for plots and stuff. We had some questions last time also about sort of reproducibility of stuff from the chatbot, and I think this is actually a great way to make sure that your code is reproducible. Is if you use the MCP server through VS Code or through one of these other interfaces, you can actually just ask it to use the PopHIVE connector to sort of help you access the data, pull in the data that you want, and then provide the R or the Python code for that it used. So then you can sort of see exactly where the data is coming from, how it's processing the data, and then you can sort of merge it in with whatever sources you want or generate whatever custom visualizations you want. Maybe I'll stop there. I see we have a lot of questions in the chat, and happy to sort of dive in more on any of these aspects.
Yeah, Dan, maybe what I could do is I can read some of the questions and kind of answer them together, if that sounds good. I would say that I had to disconnect my connector and then reconnect it to get it to work. And so when I go to Claude now and I go to my connectors, PopHive is listed and is connecting onto the connector. So, but it did look like there was some error on all of them as a whole. So, there was a question here specifically about appreciating walking through the architecture of the MCP server. So I don't know if you could do that.
Yes, we should have invited Nick, who's actually our AI guy, who knows about this stuff. But yeah, so this is yeah. I'm not the best person to be talking about this, but basically, there's a set of tools or functions that I think we've got 6 or 7 functions that have like distinct purposes. So around finding the data, generating the plots, comparing the data sets. So this is sort of how, when you ask a question that goes to the MCP, it finds the relevant tool. This probably makes more sense to some of you than others. This is not my thing at all, so apologies. But sort of tries to identify the relevant tool. It looks through our data catalog to find the relevant data sets, and then generates the sort of output and analysis that we want. So, this is sort of an example of, if you ask the question, is RSV rising in Connecticut? It sort of calls a set of tools, based on the disease. So it finds the relevant disease name and geography, Those are sort of well-structured fields in the MCP. It sort of filters down to the relevant data, loads the data file, filters it down, and then because we have multiple data sources going in, it looks to see whether they're telling us a similar story or not. So it has this sort of like voting function where it determines whether they're sort of telling the same story, a different story, and then goes through and sort of synthesizes that. We do have a lot of the stuff that we did in the training was sort of generating the caveats, making sure that it was appropriately interpreting the data and not over-interpreting certain things. And there are certain aspects of the code that we can tweak to sort of make it, I guess, more or less conservative in a way. So these are the different tools that we have now. So for interpreting trends, there's the get trend one. There's one for comparing geographies. There's one for sort of just providing general descriptive information. There's one that should sort of go through our entire data catalog and tell us, so if you want to just find out what data we actually have, you can do that. And then it goes through some of the specific, these are really kind of issues and problems that we identified as we were going through this, and this is kind of the user guide for us. The rules.yaml file, so there's a bunch of files that sort of specify kind of where to find the data and how to answer the question. So there's like a YAML file, which basically has information about sort of how the server should structure responses. And this kind of was built iteratively through several rounds of training. And again, there are these sort of parameters that you can tweak to make it sort of more or less sensitive to different aspects of sort of how much the things agree and stuff. But you can see that there's sort of some templated text here that it can draw from, for some of these different tools that get called. I'm not sure I can provide a lot more like technical detail than that, just because, again, I'm not a software engineer on this stuff at all, but it all lives on a GitHub. It was built by the Anthropic engineers, one of whom was here at the last session that we came to. It gets deployed through our servers. So we host it on, there's an Amazon server that hosts it. But then everything runs locally on your machine like it would for a regular sort of Claude session. And that's all I can say about the infrastructure.
Dan, is this part of the GitHub repo public?
This is not a public repo, but I'm sure we can share any pieces of it that people are interested in. I don't think it's public. Yeah, I'm pretty sure it's not public.
So along those lines, we tried to kind of tailor this MCP to be honest about like what we knew and didn't know, so it wouldn't hallucinate, trying to be, and really bringing in a lot of the information about data lag and other things, which there are some questions that I wanted to highlight there. Dan, there's a lot of comments in the chat about, our system isn't going to let us use Claude. We really have to use Copilot. Google, like what are kind of other topics? Can you talk a little bit more about how to like access our data in general and kind of our partnerships with other tech companies and accessing our data?
Yeah, so a couple of things. I mean, first of all, the MCP server itself is not necessarily a Claude tool, so you should be able to plug it into to any other sort of AI tool. I haven't done that, so I'm not exactly sure what the process is, but I think you can probably ask the AI tool that you're using how to connect an MCP server. So you can actually see, if you go to our website onto the Claude page, the connector itself lives on this URL, which I'll drop in the chat. So you should be able to point any of your chatbots at that URL and get that. In terms of other partnerships we're developing, yeah, I mean we're working on developing um, some tools with the Google Commons platform, which is, it's a very different type of platform, but allows you to sort of sort through and find the data quite easily. And we're hoping that that'll also, for sort of simple queries where you're just trying to find a data set or find sort of a top line summary, you'll be able to sort of use that platform as well. Yeah.
There's a question about there, like, can you point Google Gemini to the data and to the MCP
What
outside of?
fake meeting that I never finished?
I believe so. Yeah, I think any of the AI tools can use the server if you provide that link to the MCP that we just shared. It's also, I think I found that um, like even like when the MCP server was down for the last hour, Ann and I were just playing around and asking some questions, and it actually at least Claude does a pretty good job of just like finding our data anyway, even without the MCP server and downloading it. So the MCP server, I think, just is helpful in providing some structure and um, additionally catalogs the data in a useful way and provides some structure around the responses that you get. But all of our data are open. It's all the data live on a GitHub repository, so you can access the data um, relatively easily and pull it down onto whatever system you're using.
I see, Jim, you've got your hand up, and maybe turn to you, and then there's some other questions in the chat too.
Yeah, thanks, Ann. So Dan, appreciate that. Sorry for my confusion. So when we point the MCP server, though, that's the MCP server that's hosted in your AWS instance, right?
Yeah.
So we'd have to have some sort of sharing agreement or data use agreement between us and Alaska DOH, or is it outside the firewall, or?
No, it's a public. I mean, you should be able to just access the link, no problem. It's an open.
Okay.
Yeah, I believe. Again, I'm not. I don't know about the technical side of this, but I'd be happy to put folks in touch with our AI guy as well, and I'm sure he could.
Yeah, that would be great. And just like we had in the conversation bouncing around, it would also be great if you just had that as an open GitHub repo too, so we could put the MCP locally if we're using Copilot or Gemini or something like that.
Yeah. Yeah, I mean, I think it's hosted in such a way that you should be able to access the MCP. Like that part should be public. Like I think the MCP itself is public. I think it's just the sort of backend stuff that's not. But I will look into that and we can find out how to get that to you.
I think from a process standpoint, this had nothing to do with Alaska DOH and we're philanthropy funded right now through Yale to be able to do this. And like part of the mission and part of our agreement with like Epic Cosmos and sharing data is that it's publicly available. And so like we actually don't do really data use agreements for like anyone who's using our data. It's all kind of publicly available. We have some with kind of different organizations who are sharing, but we don't have any identifiable data on the back end. Dan, there's some questions about like Epic data and like the lag time from Cosmos. So maybe you could talk a little bit about our Epic data access, our requirements around that, which gets into the same thing, and the lag.
Yeah. So the Epic data get updated roughly every 3 weeks. So currently I think our data are up through, I don't know, June 26th or something. The whole data set will refresh next Wednesday night. So next Thursday we'll pull down the latest data for cyclo and for our infectious diseases. So yeah, it runs anywhere from 2 to 3.5 or so weeks behind the current time, depending on sort of where we are in the month. But yeah, and we update our different Epic data sets with different frequencies. It's a very manual process to get the data out of Epic. There's unfortunately not like an API that we can pull from to get the data out. So we update our infectious disease data from Epic, every time the data updates every 3 weeks. Some of our other indicators like chronic disease, we update like every 6 to 12 months, depending on the indicator.
It's a great question. It comes up a lot. It comes up also a lot on like how much data can you explore? So we can go down to the zip code. It just takes a lot of effort. We use, I would say, Claude a ton in scraping publicly available data, but we don't have an API access to Epic. It's a much more manual pull. And so that's why also working with you all to say like these are the data elements that are really helpful for us for public health. We're always happy to have a two-way conversation with you to say, we get things from states all the time, like Dan's been doing a whole alpha-gal review here recently. And, the cyclosporiasis website came up because of just state health officials and others like emailing us and saying, hey, can you help us understand this? How about the test percent positivity? Can we see the number of ED visits that are happening secondary to diarrhea versus the number of cyclosporiasis cases? So much of our data pulls comes from two-way conversation with you all on saying like what's working and what's not working, what data do we have and not have, so we can put that out there. So it's kind of like outside of like the MCP space, but I would say that we use AI a lot on the back end to try to pull a lot of this data to move forward. Meanwhile, Andrea is testing this with Gemini, so excited to stay tuned. We'll see what happens there. But there's another question from Ian and Dan. I will turn this to you, but
Yeah,
when using the connector with the MCP, I'm assuming that Claude runs on the model that you're currently using. So if you're using Opus and everything you're
yeah.
running also runs on Opus.
Yeah, that's right. So, I mean, typically if I'm like the query I just ran was using Sonnet. I usually use Sonnet unless it's a fairly complex query, just because otherwise you burn through your tokens pretty quickly and then you hit your session limits. Yeah, for most things I'm using Sonnet. But yeah, it will use whatever you're using at the time. We've tested it a bit with Haiku with the connector, which is like the cheapest model for Anthropic, and it works okay. But like if you want to get like nice plots and stuff out, you should probably use either Opus or Sonnet.
Yeah, and part of the reason we ended up going this direction, we actually looked a lot about having AI kind of sit on top of ours to create better search engine, ask questions, but just the tokenization and the cost to us was just so much that that's why we ended up going to via this like, you can connect via an MCP server. I would say a lot of state health departments are connecting directly to our data from GitHub and looking at it. But what we've been hearing from a lot of state health departments is that the MCP has been really hypothesis generating. So before they like want to download or look at the data, they can just say like, what do you have for San Francisco? Like, what do you have for California? What do you have for the space? And then being able to audit kind of essentially the data sets and what it's seen. We've also been hearing from communicators, like if you're like, I need to make this plot work for TikTok or for Instagram, like that was actually a pretty big technical challenge to make those all downloadable for different images from our website. And so kind of our workaround was again being able to access the data and then having MCP sit on top of it and say, make this available for a TikTok graph or make this available for my website or do it in the colors that I need for the Department of Washington or things like that. So being able to take and download the data. So those are the ways that we're hearing it's being used quite a bit. As Dan mentioned, it's only pointing to our bundles right now. And so trying to figure out how to have it point to more of our data sets, particularly as we're adding them. And Callie, who you guys met, who's on here, is looking, and we're hoping to fairly soon release a lot of geographic details so that you can look at your county and your state and compare that. So we imported kind of the 92 different metrics that County Health Rankings data has been using, and then there's 11 different unique data sets that have not been previously done by county that we're adding to that as well. So I know many states are looking at how to support local health departments, how to support their counties to look at the health and well-being of their community as a whole. So putting out then on our website, we'll be able to have that. You can download those files and be able to put them up. You can connect to our GitHub, or you can use the MCP to also look at better geographic awareness. And then Dan put in the chat the cyclosporiasis. So again, you've got EPIC data on there, the NNA data to be able to look. And then again, using Claude and others to take like, what Kentucky's health department put out and putting it next to Michigan's, et cetera, so that you can kind of see across county lines in a different way, and happy to kind of walk through that space. But those are the major questions that I'm seeing in the chat right now. Feel free to raise your hand, ask any questions, give us any challenge you have, what you want to see, how we can make your lives easier and better. There is this unique role that in some ways we get to play not being in government, being able to, somewhere like we're willing to share data with you and you can share back to them, but we just don't want to share with the government specifically. And so we're here to help make that process easier, or be able to use different tools to be able to try to facilitate the amazing work that you guys are doing. Ian also said anecdotally found Sonnet somewhat lacking when using PopHive in order to magnitude better responses with Opus, especially getting generating results. So yeah. Yeah, Ian, go for it.
Sorry, just trying to find the controls. Yeah, I was just going to say the lesson for me there is if something, doesn't work great, then it's possibly Claude, not PopHive. And it's worth bumping up the model and seeing if that fixes any issues, because certainly the times I've tried it, it's made a big difference.
That's great. And I think one challenge that we found, and you might find as well, is like getting it to actually use the MCP server, which is like even if the MCP is enabled, sometimes it kind of goes off script and we'll just go find random data, which sometimes is fine, and like, depending on what you're trying to do. But oftentimes we're looking for a specific to bring in specific set of data, and but unfortunately that's not something that we have a lot of control over, and and that's usually why we specifically prompt it to use the PopHive data when we set our queries and stuff as well.
Right.
But yeah, I think certainly you'll get different types of responses with Opus and with Sonnet, and yeah, and depends on the specific application in some case.
I would also add that if you want to kind of like see around the corner to other data sets that we may not have, like I was working on a CMMI presentation on how like CMMI and models for payment could use PopHive data. Like using Opus or Fable is going to be much better at acknowledging what it does and doesn't know. And so like I ended up using Fable to say like, okay, look at the data sets that they're using. And a lot of their questions were specifically like looking at the CMMI populations that were doing access, like these different demonstrations, how can PopHive look at that? Well, I don't know exactly who they've got, not all of that's publicly available, but I actually thought it did a good job within Fable of saying, these are the data sets that we don't know based on this. This is what we think it is based on what CMMI has put out publicly. This is what we can see. And so here are the gaps. And so if CMMI wants to use it, here's how they can have the base information coming from PopHive. This is what they need to augment it with, population health information that is not publicly available to get the answer that they want. Versus if you use lower models, it just kind of like mushes that all into some sort of like, guesstimate of what it's supposed to be, rather than really kind of clarifying out each of the data sets. So particularly those like, how can I use this? And I find that those higher models are key.
I'm not sure I want to use a model which does a better job than I can.
Yeah, that's always the trick, right? You still have to be smarter than it is. But I find that I use Opus on the high setting. That tends to like give good quality with, I mean, depends on what kind of token situation you're in for how much you want to burn. Or you can do the thing of using Fable or one of the higher powered models to plan what you're doing and then actually have it be executed by the lower level models that aren't taking as much of your resources. That works too if it's just if it's the ideation that's the tricky part and the actual doing of the thing is less intensive.
Dan, there's a great question in here from Brad or comment about the California Department of Public Health. We've gotten a lot of emails back and forth, so maybe would you just share what you know and don't know about that one?
I can speak to it. I just wanted just to share, and we've emailed about it before, but CDPH's like security policies basically block everything from GitHub, which is, from my understanding, like the PopHive the graphs that are embedded on the PopHive website are hosted via GitHub, and so then we can't see, like any CDPH employee can't see those. The only generative AI that we could use is Copilot. So like Gemini, Claude, anything like that is not accessible, including anything on an Anthropic or Claude website. And similarly, like I was trying to look at the data catalog, which I think you guys made with Vercel, and then that was blocked. So I don't think this is a problem that y'all can solve. I think this is the CDPH like being too conservative and restrictive. But I'm just trying to share what the experience of being a California government employee is like, where all of these modern tools are blocked and we just can't use them. So
Yeah, thanks. Appreciate that. And we have heard there are other organizations that have similarly restrictive policies that have had So it's not just you guys, and it's not just we've heard from recently from a private organization that was having a similar issue. Yeah, I mean, longer term, we are looking at shifting our data hosting off of GitHub just because it's not a good solution for given the sort of scale of the data that we have now. But I'm not sure that will totally solve the problem because I mean, we still have everything in, Vercel is kind of where the website lives, but at least the data sets might be moving out of GitHub at some point. So might partially solve the problem.
Thank you.
I guess I would just say like keep talking to us about it because I think sometimes what we have found is sometimes that some additional information about like the GitHub or what the information is can help to clarify within the teams to be able to access it. Sometimes it can't. We try to make it so it's downloadable. Some states are connecting via kind of API. So just, we're trying to make it available to you all in whatever way. So we appreciate the feedback and hearing from Siri having similar issues in testing and deploying models locally on our Docker. Can you all submit tickets to AI to IT for you? We're happy to answer IT's questions, which sometimes we do, but man, you're bringing me PTSD on
And I'm sorry, I was thinking for Brad's case specifically, if he submits a ticket in, I mean, like, I've got the ability to reach out to the CIO personally, but I realize not everybody's got that available to them.
I've submitted tickets on everything. I won on the GitHub for a small exception. So like 3 users at CDPH, we were able to get the GitHub unblocked, but I have not won on anything else yet.
Well, congratulations on your small win.
Yeah, small victories.
Every part counts. And Tina's also saying having similar issues in New York, secure Claude and Gemini. But in general, it would just in general, the IT department wants more guidance from federal before it approves IT. And I think that's part of the reason why we're trying to like, you can go to our website and play around with the data and search it. You can go to the GitHub, you can go to Claude. We're trying to be like, as knowing the diversity of where states and local health departments are at with it in different ways that you can access it. Hopefully, although it is much harder if you don't spend as much time as Dan and I on the website to know exactly where to go. If you have feedback on the website to be hypothesis generating or things like that too, like we're happy to also take that feedback where we're looking at redoing our front website. As mentioned, we're setting up and hopefully in the next, I don't know, Dan, what do you think, next couple of weeks? Being able to search by location. So being able to say, this is what my state has, this is what my county has, and look at all data elements and download it by there, as well as by data sources and being able to search disease conditions. So hopefully that will allow you a lot more searchability. So it's not just like immunizations or chronic diseases, but like I want to know everything about California that you'd be able to go directly to like all the data sets that we have there as well. And that's not using AI, that's just on our website. So just highlighting that again, that does reference some of the GitHub pictures, but then also moving forward. There's a couple other comments. Yeah, go ahead, Dan.
Yeah, I see it looks like somebody solved the solution on how to get this loaded into Gemini, which is great.
There you go.
So looks like using the
Probably requires more than just that step, but that's the bash command to call the MCP from the CLI, and I just checked it. It executes at least with the permissions I have, but I have all the permissions. So your mileage may vary as a user at an org, but I'm happy to help sort that out if folks are trying to get there.
I love it. Solving in real time. And as Jeff mentioned, bouncing between models, that being able to use an MCP much more prone to hallucinate confidently. Yes. I would say that like, again, we're trying to build our MCP to be like, we don't know this data or we do know this data and here are the limitations of the data. So this one's slow or this one's in this region. But this is an opportunity for you all to keep giving us feedback on what's working and what's not working. We're hoping to sit on top of a lot more lab testing data, working with some HIEs and kind of thinking about that data, working with those kind of in the more health sector to try to get you guys more health metrics. So low threshold, just info@pophive.org gets Dan and I, and we're always happy to sit down and and meet with your team if you're like, what ways can we move this forward? We have met with multiple states just today and talking to them about what they need or what they want or working with different data vendors. So always happy to have a more one-on-one conversation with you and your team to problem solve or to look through data challenges to try to get you the data that you need. So just putting that out there.
That sort of similar end, we're all trying to do this together. So like doing it in silos is the least efficient way to handle it. So if you have any success with getting your PopHIVE connector installed, if you're not using Claude, if you're using Copilot or some other AI tool, let us know so we can share that back to everyone else who's trying to do the same thing. It would be really great to diffuse that knowledge and that effort outward.
Agree. Thank you. And thanks for letting us come twice. I feel like we're, bombarding both with coming with Anthropic, but I was like, well, we didn't really talk much about what PopHIVE is before we dove right in. But, we're humbly learning this space with you all. And so really want to co-create a better world of better data so that we can have better population health. So always looking forward to feedback, input, partnership as we move forward.
Yeah, well, I appreciate you being willing to give so many hours of your time to doing this just generally and also bringing your expertise to this community here. We're, learning and figuring it all together is what we're all about. And it's going well. Like there's so much cool stuff happening here. So thanks so much for sharing it. And folks, share your stories of MCP connector success so we can get those out to everyone. And thank you, Anne. Thank you, Dan and team for joining us. And we'll see you all in 2 weeks for building our packages using AI agents on the 6th.
Awesome. Right. Thank you all.
Take care, everyone.